Welcome to TechNation's On-Demand webinar series. This is a streamlined series of on-demand webinars focused specifically on the biomedical and HTM industry. New webinars will be added on a regular basis, and each will be eligible for one continuing education credit from the ACI. At the conclusion of this presentation, you'll be able to access a link that will take you to a quick survey. You'll be able to download your certificate once you submit your survey. Today's presentation is titled Clinical Device Efficiency Roundtable and will be presented by Samuel Hill, Tracey Hughes, Travis Kobernick, and Bob Swaskoski. We would like to thank our sponsor, Medigate. Medigate is the industry's first and leading dedicated medical device security and asset management platform, enabling providers to deliver secure, connected care. Medigate fuses the knowledge and understanding of medical workflow and device efficiency and protocols with the reality of today's cybersecurity threats. With Medigate, hospital networks can safely operate all medical devices on their network, enabling the deployment of existing and new devices to patients while ensuring privacy and safety. For more information, please visit medigate.io. As I mentioned earlier, our panel of experts will explain clinical device efficiency in a roundtable setting. Samuel, you may begin whenever you are ready.
Hey, thank you, Jennifer. It's really an honor to be here again with this podcast and this webinar series. So my name is Samuel Hill, Director of Product Marketing with Medigate, and I am just really honored to be joined today by a distinguished group of our customers to discuss some of the ways that we're helping to improve their clinical device efficiency. So I'd like to introduce our speakers today. So Bob, for you first, would you mind telling us a little bit about you, your role, and where you work?
Sure, I'm Bob Swaskoski. I'm the Chief Information Security Officer for Heritage Valley Health System. Heritage Valley is a mid-size health system located in southwestern Pennsylvania. We have 3 hospitals. We have approximately 65 physician locations and other diagnostic centers, about 3,500 employees. I've been with Heritage Valley for over 20 years, mostly in the IT department. I've been CISO since 2015. And at one point in my tenure, I also was responsible for biomedical engineering that was integrated in with the IT workflow. So glad to be here.
Bob, it is a real honor to have you here. I'm grateful for you to be able to lend not only the background you have on devices and IT, but also the security angle as well. I'm really interested to dig into that a little bit. Tracey, good morning. Thank you for being here.
Good morning. Hey, I'm Tracey Hughes. I'm the Senior Director for Clinical Engineering at Duke Health System. So Duke is a major academic medical center centered in central North Carolina, and we manage about 65,000 medical devices as part of our HTM program. Been here about 10 years at Duke and about 30 years now going in the field.
Thank you, Tracey, and I'm excited to hear more about those 65,000 devices. Travis, good morning.
Good morning. Glad to be here. So this is Travis Kobernick. I'm a Director of Clinical Engineering at Parkland Health and Hospital System in Dallas, Texas. Sorry I do not have a video camera up, so y'all can't see my ugly face. So I've been here at Parkland since 2012. Prior to that, I worked for a Baylor Healthcare System also here in Dallas, Texas. Our current inventory, we're running about, 33,000 assets that we manage in our clinical engineering department, about 12,000 of which are integrated and which are actually up and running on the Medigate platform currently.
Excellent. It's awesome to have you 3 here. And now, so what we're talking about today is the concept around clinical device efficiency, which is a module that Medigate is releasing. And I know we've all had conversations and with Medigate to talk about the real world and the workflows that clinical device efficiency can help you guys solve. So let's talk for a little bit, and I'll ask Tracey to start with this question, and then all of you guys can jump in and add your expertise as you see fit and want. But let's talk about some of the things and the challenges that you were seeing in your world that kind of brought about this need to have more efficient operations of your clinical devices.
Sure. Specific kind of at Duke, and I'm sure this is the case across other health systems and entities, you know, we are faced with smaller dollars that are available for capital spending. You want to be mindful of the resources and the utilization of those resources across the system, understanding and trying to make sure that you're making the best decisions and the right decisions when those times come to replace or to add. And I think that's kind of where we started with kind of this clinical device efficiency was, you know, what is out there that can help us, you know, make the most informed decision that we can. In particular, we struggled a lot too with some use of rental devices across the system and kind of understanding where those were and where they actually really needed. And so those were some of our key drivers.
Yeah, Bob or Travis?
Sure. From my perspective, you know, the first key was visibility. As Tracey said, you know, you have devices across an enterprise at multiple locations, and not necessarily having the visibility into where they were and how they were being utilized. So the first question that the Medigate platform resolves is, what do I have? What is the scope of my world? And as you said, there's such huge investments in this technology that having that end-to-end inventory that is accurate in real time is absolutely essential to then answering the next series of business questions.
Very good. And this is Travis, right in line with you guys. So some of the benefit we saw, you know, historically, equipment utilization has always been a challenge. You know, we're responsible for managing the capital budget for our organization in terms of medical equipment. And it's really hard to be good stewards of your organization's dollars if you don't. You got to know your equipment is getting good utilization before you can justify buying additional. You know, for example, we ran into a scenario with the CT scanner this last year. Historically, you talk to the radiology directors and they say, oh, they're all used 24/7 and, you know, we're all maxed out. We need additional CT scanners. We didn't really have any good data. We'd reach out to our folks and our PACS team and try to get data, and it's kind of piecemealing random pieces of information trying to come up with the utilization, and it wasn't very good. Well, we went live with the Medigate platform, you know, I guess it was March of last year, and we've been just building up data and for the last however long we've had the system running. And the side benefit of the Medigate system, we're able to go in there and see, you know, real utilization data. So we have 10 CT scanners. Using the data we found in Medigate, we were able to go back and have hard data to present rather than a gut feeling of utilization. And they were asking for an additional CT scanner to accommodate patient volumes. Our volumes were increasing, but not significant enough to justify.
Yeah, I think what Travis is saying is really important because, you know, a little bit of my background, I actually spent 7 years as an emergency room technician across a couple different health systems. And so I've been on the front lines with these devices that are being used. And he's absolutely right. Like the feeling that you get is that CT is full because you need to get your patient in for their CT scan because that's their course of treatment. But they're busy or they've got another patient on the bed or it's not available for whatever reason. But having that hard data to be able to look at and say, how often is this device being used? What's the average survey or study time, or those things that can help you begin making decisions around investment, expansion, or better distribution are really, really valuable. And so, yeah, I know, talk about all the devices. I have literally gone hunting through other nursing units to find hidden IV pumps that are stashed in closets or somewhere. I see heads nodding amongst my colleagues here. You guys, it sounds like a real common thing across healthcare, and we all know it's true. If you don't have the device that you need, it's hard to do your job if you're caring for patients on the front line. So tell me a little bit about that, Bob, from your environment, you know, your biomedical background and everything. How did you guys go about historically, you know, before clinical device efficiency? How did you guys
Well, prior to the CDE platform with Medigate, trying to, as you said, locate and manage, you know, fleets of devices Hear me? Hello?
I can now.
Yeah, I can't
I
hear.
can't hear Sam.
Yeah, I can't hear Sam. Okay, start over. Prior to the CDE platform, Emil, you're shaking your head no?
I can hear you, Bob.
Okay, well then I'm just going to keep going. Okay, so prior to the CDE platform, managing fleets of inventory, as you referenced, was a nightmare. Again, Tracey and Travis can agree with this. As you described, searching hither, thither, and yon for a device was terribly interruptive to the patient care process. So again, having that accurate real-time inventory, and not just an inventory, but location information. You can see where that device is based upon its location on the network, and you even have the availability, if you have the right integration, you have the ability to see that in a kind of a broad scale map as well. So, again, it takes that piece of the puzzle and fills it in effectively, so that you are not constantly searching for equipment that you need to do your job.
I agree on the IV pump situation. That was very beneficial to us to see that functionality in the platform. That we can look at any point in time and see what devices are actually online. Now, we couldn't tell if they were infusing at that moment or not, but we could tell if they were online. And we trended this over a period of time, and because IV pumps is always a sore spot for us, we're always needing more, quote unquote. And going back and looking at the data we was pulling, we're averaging at any point in time about 35 to 40% of our inventory in use. So it's really hard to justify, going out and spending another $500,000 on additional pump modules whenever we are not utilizing the pumps we have. So we use that data to drive an RCA, to drive process improvement, to get better, more efficient uses around our IV pumps and the processing, the distribution, things of that sort. So the data we're getting out has been very helpful along those lines.
Yeah, I would echo that as well. Prior to kind of having the clinical efficiency and having that visibility across the system, you would, a lot of it was gut feeling. We actually would do physical rounds where we would go to the units and peek in every door and say, okay, one was in use and there's 2 channels and, how many, so that you could kind of see that. So a lot of kind of manual labor to get that solution. And now you have that. We have the integration with our Cisco Prime, which does provide kind of that wireless view, and we can see it on maps and really start, drilling in, talking about whether it's in use or not. And as Travis mentioned, really focused now more on process. We can show we are similarly at 35 to 40% utilization. And so really it's about how do you get them out of the room? How do you get them back to a soiled utility room so they can be cleaned and turned around and made available to others? So it really changes kind of that conversation and where your focus goes.
I think a key to that, though, would be trust from your frontline teams as well. Because, you're looking at a nurse who's saying, I need this to do my job, but I'm going to need it later. And so how do you go about earning that trust from your frontline care teams that they're going to have the device that they need?
Well, I'll speak to it, but we've been working on that for a number of years. That is the key challenge there, is you have to have buy-in. You can have all the data, all the technology in the world, but until your clinical folks are confident that the process will work, they're not going to give the pumps up. They're not going to do it. And so we have done education, re-education a number of times. It's an ongoing challenge for us, but the good thing is we do have data to present to help drive that and build the trust. Getting the nursing leadership to agree with about presenting data. Before it was just he said, she said type of stuff. Now we have data to back it up, so that helps get the executive level more confidence in it that it will work. So that's driving nursing education, so on and so forth. It's trust us it will work, and we'll get there. We're not quite there yet, but we're still working on it.
Yeah, I think the CDE platform, I'm sorry, I think the CDE platform, as you said, Travis, it gives you that data that you can use to then have the discussion. Collaboration is key. And as you said, this has been an ongoing challenge forever in terms of gaining that trust with your stakeholders and your customers. But I think once you can sit down and show them the information, then it starts to become a little more real, because now we're all focused on the actual facts. And like you said, out of the anecdotal, well, when I went looking for it, it wasn't there, or whatever the case may have been in their experience. So I think having the data, like you said, gives you the ability to have that collaboration discussion, which is a different perspective than what you've had historically.
Yeah, and I would add, I think when you're having those conversations and as you're developing your model, right, we're able to kind of shift. We utilize a mix of a par level as well as kind of an on-demand. And with the data that you have, you're able to adjust those par levels. If you have that data to kind of show them, hey, we always are stocking you, with 7, but we've seen that, 5 of them have sat, here for, 2 weeks, or the kind of the turnaround on those is different. They're more willing to go, okay, I'm willing to, scale back and, kind of free these others up so that they can be used elsewhere in the health system. And then, again, knowing you've got that fallback, system for on demand if you did run into it, but, kind of trust that and let it work through.
Yeah, I would say it's such a powerful way to build trust, to being able to tell them, hey, we saw that you were actually needing 25% more devices over the last couple of weeks. And so we've gone ahead and adjusted your par level. So you should have about 25% more to make sure you're doing the work that you need to do. And then, should you not need those, your burst capacity is now finished. That time is finished. We'll put them back into the general availability pool. But you're right, that's an easier conversation when you're presenting real numbers and actual metrics. And healthcare people are actually pretty smart. I think we can all attest to that. And they typically can respond well to data and well-reasoned presentations. And so, but I think that's a really thing. So the thing I want to talk about next, Bob, is asking you. So coming from the biomedical side, IT, that long history you've had there at Heritage Valley, now the CISO for the last half dozen or more years, you've probably seen a few shifts, not only in your way of thinking as you've evolved your career, but now into the security space. Obviously, the security world is a very rapidly evolving space, and especially around clinical devices. So how do you look at the value of real great operational data for your clinical devices? How would that impact your security strategy?
Well, I think prior to not just CDE, but the Mitigate platform entirely, again, we didn't have that visibility. So now we actually have a platform that will not just give us that visibility and also the analytics here in terms of utilization, but the real-time integration with the rest of our security infrastructure so that we can manage those risks on a real-time basis. And I think, we're able to be more proactive. And I know that's, difficult within cybersecurity because, the next threat is evolving as we speak. Yeah. But again, with the technology that we have, with the complexity, the layers of software and integration, anything you can do to try to get ahead of that curve from a risk management perspective is a win. It doesn't have to be perfect. You just have to, have those small incremental wins. And I think having the data at your fingertips and having that integration with the rest of our security stack, integrated with endpoint protection, integrated with Cisco Prime ICE in terms of network location and authorization, and integration with our checkpoint firewalls and other devices, it gives us the ability to directly manage the risk of the fleets rather than being totally in a reactive mode driven by perhaps a recall or some other media event that is advertised in terms of a flaw or a vulnerability. So we feel like we have much more control over our destiny, you could say.
Yeah, Travis or Tracey, we'll start with you, Travis, perhaps. Tell me about that from a security perspective. Now that you are having a better understanding of the data around your devices, kind of where those devices are, how often they're being used, what they're doing, those type of pieces of information. How does that affect your contribution to the overall security stature there at Parkland?
Well, yeah, to be full transparency, we went from non-existent to actually doing a really good job with it. So historically, our network medical devices were pretty much excluded. We were the rogue devices on the network. We'd get into those conversations. It's an FDA approved medical device. We can't modify it, yada, yada, yada. Well, we've beaten that horse enough. So we're at the point now where we're getting, not only are we getting the shotgun approach of vulnerabilities that exist out in the world, it's meshing it up to our inventory. So we say, hey, this specific device, this specific asset number located in this specific unit that is currently online, that level of detail, saying it tells us what the risk is, what our recommended mitigation strategies could be. Then we analyze that data and take whatever action appropriate, working with our partners in IT. And another little perk of this is that the system trends the data in Medigate to where it shows you the hours of utilization. So it has like a heat map, so you can say, hey, this machine is usually offline after around 3:30 or 4. So now that gives us enough data to where we can reach out to the clinical leaders and say, hey, we're looking at, from 3:30 to 5:30 doing some patching on your device or whatever. It gives us some data to where we can go in there, with some sort of a tentative schedule to coordinate downtime. Whereas before it was purely a manual conversation that sometimes would be a little bit confrontational.
Yeah, they're holding on to the devices. You're trying to take it from them to do whatever security thing you need to do. Like, no, don't take it. But yeah, I need to. It's not okay. Yeah.
Their pitch is, if it's working, don't touch it.
Exactly. Yeah.
Yeah, I would echo that too. I think that clinical device efficiency, because of it, showing the hours that it's typically in use, kind of down to the device or across the fleet, it helps one with knowing when it's available to be patched, but it also helps, like if you're trying to schedule vulnerability scans or do any of that kind of a testing, you've got a better window that you're not going to be impacting, patient care when you come to that. I think overall too, I love that with Medigate, when those vulnerabilities come in, you see them as, Travis mentioned, which devices are impacted. Before in our HTM inventories, you always reported serial number, model, you had all of that information, but you didn't have a lot of that software versions and, and the things that, it's operating and sending traffic across the port, and so therefore it's infected. Medigate gives us, kind of down to that level. So then you can work with your vendors, easier to try and schedule that information. Which things are impacted. You can make educated decisions based on what that risk is and what that vulnerability is. So, you only have so many hours in the day. These are the things that we're going to, focus on first, second, third.
And yeah, so have you found that to be a better operational flow for you and your teams to be able to say, hey, I know kind of a priority list almost of, this is the most critical work I have to get done today. These devices are most at risk, most insecure, or they have the most, or maybe this is the easiest task to quickly elevate our security posture by, segmenting this device off the network or to their own specific area, or applying this patch if it's available. Has that helped you guys as well?
Oh, absolutely. I mean, the ability to have that discussion amongst all the stakeholders, like I said, the platform begs collaboration, and you're all looking now at the same information, and you can strategize, make those plans, prioritize your risk, and then also prioritize your ease of remediation, and even if there's interim steps. So as Travis said, historically, you didn't have any of that insight and any of that information, and you were just, totally reactive. And now you actually have a platform that allows you to manage it.
Yeah, it's a lot easier to tell the operational units, like, this is why. You can explain some of the why. I think all of us are, even if you're working on the front lines of healthcare, you're generally aware that it's a inherently insecure world out there, and that people are trying to get inside the walls of your healthcare institution, and they want that patient data, and it's very valuable. So we're generally aware of that. And so anytime you can come to them and say, here's how we're helping you operate and keep our patients and their data safe, and these are things that we're doing, and you have the information and the details to kind of back up your argument, I mean, it is a much simpler conversation, I think.
Absolutely.
So I want to ask about probably one of our favorite topics, and probably for you guys as well, the idea around preventative maintenance. All these devices, you've sunk millions and millions of dollars into them. They're all FDA rated and whatever their class level is. And now we have to make sure that they maintain compliance with their manufacturer's recommendations, but also with the FDA, and then they are going to continue to operate at the level that you need them to. Let's talk about preventative maintenance for a little bit. How has better operational data or better data about the devices helped you perform preventative maintenance? We'll start with you, Tracey.
I think as I, kind of look on that, first and foremost, obviously, is the transparency and kind of where it is, on the system. So we have an integration with our CMMS. So we not only kind of bring over, the asset information, the building and the location that it normally should be, your system is showing again because of kind of how we have it structured and kind of where it is on the network. It's showing kind of if it's in use or not in use. It helps us plan our resources when we can send people out. It lets us, work with the departments and the teams to know, and then just actually kind of getting access to that equipment whenever it's needed, so that you can stay compliant for it. I think it's early days for us, but I'd like to kind of tease out a little bit more what could be done to help us, as we start going further down the path of doing alternative equipment maintenance, which Joint Commission is kind of allowing to help you reduce frequencies that are needed, to kind of see what it can do to help us in that regard.
How about you, Travis? How has preventative maintenance been impacted or changed in any way there at Parkland?
Yeah, it's been a helpful tool for us for knowing what we have exactly, what we have on our network, what's in the building, what's not. A lot of our, most of our devices are highly mobile. They move around, and unfortunately, sometimes they actually move out the door, not just within the doors. So, a little bit going into Medigate and being able to, at the click of a mouse, find out when that last time that device talked to the network, gives us a pretty good indicator whether it's physically here or not. And having the proper integrations in place, you can say, yeah, it last touched the network here in this unit on 15th floor or whatever the case may be. We didn't have that before. It was just like a shot in the dark. You're trying to figure out where your devices are, whether it's here or not, and whatnot. So it gives us a lot more data to do a kind of an analysis or investigation for any specific device we're trying to track down, and also see if it's in use at that point in time or not. To kind of coordinate downtime. If it's a fixed device, seeing when its hours of operation normally are, things of that sort. So in terms of equipment availability, location, and confirmation of it still being here, it's been very helpful and created a lot of efficiencies for us. Historically, we had a very inefficient model of you get your list and you go run around the hospital looking for them, and you waste a lot of man hours doing that. And so our staff like it, having something to look for specific rather than just kind of randomly walking around looking for something past due for PM. So
we all know there's probably that one device that you're like, oh, this is the 2 devices that I still have left to get through that I need to get, and you're looking in every closet possible. You're wearing your running shoes to work that day because you're going to do a lot of miles.
Yep.
So
yeah, I mean, with ours, we, being an academic medical center, you've got the research buildings and things that are associated with it. And, they have little legs, and they kind of end up running out. But because we've got that integration on our wireless, we're like, oh, it's on this AP, it's sitting over here in this building. It's not a place that our techs would have ever even, when you're doing those rounds and you are wasting all those hours kind of walking the halls, those weren't halls that we were, going to have gone to or would have thought to. And this will kind of point it out, and you're able to, focus in. So.
And then I know that another piece to this is the idea around using it more efficiently for kind of that alternative equipment maintenance. I know, Tracey, you just mentioned that, and I think that's a real key topic. Have Bob or Travis, have you guys explored ideas around alternative equipment maintenance at all?
For us, I mean, we have an alternative equipment maintenance program. We haven't really done a whole lot regarding any kind of cybersecurity data we're gathering to impact our alternative equipment maintenance. Right now, we're still kind of status quo, working off, maintenance history, things of that sort. Now, we will be, obviously, at some point, we're still playing catch up on our known existing risks and vulnerabilities. Once we get to a acceptable par level of our vulnerability backlog, we will be implementing cybersecurity management strategies into our maintenance, our preventative maintenance schedules. So that way we'll be touching devices, checking certain aspects of the device, using Medigate on a proactive basis and not just purely reactive.
Yeah, we have for years, from an IT perspective, had a very mature program in terms of maintenance and patching and so forth. And we're trying to use that historical experience to help us to evolve that from a medical equipment alternative preventive maintenance perspective. So it's part of the plan. We have to continue to grow to get there. We're not there yet. A few more challenges in that regard, but again, we're on the road. I mean, we have the tools, we have the data. It's now just a matter of iterating and continuing that collaboration amongst all teams. And I got to say that I've struggled for years to get between my friends in IT and biomedical and my team in security all on the same page. And the Medigate platform gives us that opportunity to do that. And that makes a significant difference. And plus the integration again with CMS and the integration with other inventory management systems. I mean, that's just, this has been something that, everybody's needed for a long time. And now it's finally here, and now we can actually leverage it.
Yeah, I think if you can tell your colleagues and peers across your organization, hey, let's all read off the same sheet of music so we can make a symphony and play the song or do it together, you're going to make much more cohesive and pleasing music for the audience to hear, which, audience in this case, our patients, our frontline care staff, those that are depending upon the devices and our tools that we're using. And so that's a really great analogy for it, Bob. I appreciate the fact that you've really brought that idea of collaboration amongst the cross-functional teams. Tracey, how's that worked for you? Have you seen that level of engagement amongst peers of yours across different functional units?
Yeah, and we've been blessed because we've been part of the IT organization for some time, and so had really strong working relationships, across our networking, our ISO teams, as it went through. Now that we've got the Medigate, I mean, it really has just kind of amped that. You go from a 1.0 to a 2.0 because collectively you're working together on a much more regular basis about decisions about how you approach, the different, work efforts and things like that. Right now, we're going through a situation where we're doing some work on our wireless network, and they're upgrading some of the controllers, and then they're doing they're switching over from one of their SSIDs, and they're going to take that one down, and everybody's got to kind of move over to a new one. Well, using Medigate, we were, folks in IT have always kind of had that tool on the backside to kind of see, they could tell, hey, there's this many devices on the network, but they didn't know kind of what they were. Now we can see that, oh, they're medical devices, or they're, devices in plant accounting, or engineering and operations, those types of things. And you're better able to say, okay, now I want to just filter and see what's on this particular SSID that we're talking about. And now, because you've got clinical device efficiency with that location analysis, you go into the map and say, oh, here they are. And, we can kind of, get work to go target and, move those over, especially as you're trying to hone in on kind of, your deadlines, you're getting close and you're down to the last couple, those types of things. So really excited.
Yeah, nothing worse than that SSID being, shut down, and you've got, still another 1,000 devices that are looking for it because that's their login credentials to the network. You're like, well, that's not working today. Yeah, I got to find those devices ahead of time, and it's great you can bring that into that planning process as you consolidate SSIDs. So I wanted to ask, I know Travis was sharing a story about how they looked at their data to see about CT scanner utilization and were able to help their organization make some decisions. I know CT scanners, they are not cheap devices. They're obviously, and then to put them into your building is also not a cheap process because of all the construction and maintenance. I mean, just, we're talking millions of dollars here, right? It's something that is, you know, every health system, if you go to the board and say, hey, we can find another $1 million that we're not going to have to spend, they're happy. They're very happy, as I'm sure you can imagine. And you know what? One of my, a mentor of mine is the CIO of a children's hospital, used to say, hey, for every dollar that I save in IT, that's a dollar I can contribute to our uncompensated care fund. And I know that we all have that perspective of saving money actually helps us better deliver for our patients and for our community. So what other examples have you guys seen where this data has allowed you to make informed decisions that potentially saved your organization some significant money and was able to help you guys be in a position to either maybe not return budget, I don't want to take your budgets away, but maybe do other things or better things, stuff maybe that you've wanted to do for a long time because of some of these operational savings?
I can say from the Heritage Valley perspective, I mean, we've started to leverage the utilization data in terms of capital planning, and I think Travis mentioned that previously, as well as Tracey, that having that utilization now, it's a different conversation, and it's not a confrontational conversation because everybody's looking at the elephant kind of from their perspective, and you can look at scheduled visits, and then you can look at charges and total revenue. But now when you bring the actual device data to the table and you sync them all up, it's not a matter of my data is better than your data. It's a matter of let's look at the complete picture when we're making this decision. And again, historically, because there's been so many challenges with equipment management, people bought ahead. And it's, like you said, Travis, for the Samuel, for the big devices, it's a big number and a big question. Mm-hmm. But when you're talking about fleets of pumps and people are buying 30% extra just in case, or because they know that it kind of ebbs and flows, or medication cabinets is another big one. Those are becoming much more expensive as well. When you're buying medication cabinets, and again, the manufacturer, no offense, but I mean, they're trying to say, well, you want to make sure you have a certain buffer there. It's real, but at the same time, if you can bring to the table the actual data, it helps you to manage that buffer. And that buffer, again, is, like you said, real dollars that you bring back to the mission of the organization. So we have been able to use the data in the capital planning process. Many of these capital plans are multi-year, 3-year, 5-year, long-term equipment leases. And we've been able to use this to help educate the finance team, the line of business folks, the clinical quality people that are involved in the process. Everybody kind of gains the benefit of that utilization data to help flesh out the full picture of what we have available to service patients and where. Again, let's move it between locations if that is the best efficient use for it, not just buy another one.
Yeah, I spoke about the IV pumps a little, and we all talked about the IV pumps and the CT scanner. Another example we had recently was with our fluoroscopy C-arms. So we had a specialty C-arm. Well, those, the specialized ones, they're pretty expensive. They're pretty pricey. And the doctors were going out for another one based on volume as their justification again. But was able to go back and pull utilization on their existing fleet. And as it turns out, we have a specialty C-arm, very high dollar, that's getting really low utilization. And basically, I don't remember what the dollar amount was, like $400,000, I think. But we were able to go back and look at the functionality and capabilities of that. And for I think it was a $10,000 upgrade to that unutilized C-arm, it'll do the same procedures that they were asking for a net new C-arm. So we cost avoided, like $390,000. So when we're looking for an ROI on a system, such as a Medigate, it's not necessarily there's a direct ROI, but there's a lot of cost avoidance capabilities. And it's been very beneficial.
Yeah, I would agree. I think, for us, it's very similar to what Bob and Travis have said. You know, it's about before you make that purchase, taking a look across your fleet and seeing whether it is a reallocation of that asset, so you could, you know, physically move it or plan to, you know, put it somewhere else, or is it shifting, you know, volume into, you know, other areas. So when you find and you look at those hours of utilization and you see pockets and say, oh, you know, it's not really that we need more, you know, we just need to use what we have, you know, a little smarter, you know, be smarter about what we're kind of doing with it. So I think that's key.
Yeah, I know. Bob, your point was really good, I think, too, of like, if your organization is buying just 30% more devices just to keep up either with demand or because you're growing, obviously there's a growth path that's definitely real. And of course, no one's saying get rid of your buffer. We should certainly have a buffer, especially for high use, highly mobile assets. But if you're saying, okay, if I don't need to buy 30% more, I mean, those devices, that fleet, they're thousands of dollars each. And we're talking about thousands and thousands of devices that would be purchased every single year. And so if we can better use, you know, an IV pump is a classic example. We all know it. It's you're buying thousands of them every year at, you know, thousands of dollars. If we could start chipping away at that a little bit, we're really starting to see numbers return to your budgets, either from a device perspective or back to other units that could use that money. Right. And I think that's a really powerful statement to be able to show your business that we can do more with less. And something I've actually been thinking about a lot lately. You know, we all know our nation right now is challenged in our supply chain, and our globe exactly is challenged in our supply chain. You know, you're buying 30% more devices. I actually wonder when we will receive those devices because of some of the challenges. I've not looked into that incredibly with depth, but you know, being able to better utilize what we already have is probably going to be a little bit of our status quo for the next period of time until things recover a little bit. So that's something I've been thinking about from a device utilization perspective.
You guys also have in the device efficiency, you know, now there's a benchmarking, you know, section as well, and that's really nice. I've started to go in and kind of explore that with the groups, because you can break it down, you know, by academic medical center, by volumes, you know, kind of by the size of the organization, and see if you have, you know, more than your typical, you know, kind of across the board. And that's just, you know, again, another data point that you build into it.
Do you use that, Tracey? Is that something you're looking around and comparing Duke as an academic medical center with similars, or tell me a little bit about how that's affected your deployment?
You know, I think it comes back, and it's a place to start, right? So, I mean, if you start taking a look at those benchmarks and you're kind of seeing it from that standpoint, when we were talking about infusion pumps and saying, oh, you know, we see we're not necessarily the best at, you know, in terms of, we've got room for improvement in terms of utilization overall across the board. But when we take a look at from an academic medical center standpoint, we're actually under, you know, the benchmarks that you're seeing for other organizations. So you're like, okay, you know, we're not in, you know, comparatively speaking, that kind of a thing, but there's even more room to grow. And for some of those others that may go in and see that not only are we underutilized, but we have more than, you know, kind of the average here, you know, that's another, you know, checkpoint for, hey, this is why we're trying to kind of drive to this, you know, end goal.
Yeah, Tracey, I have to agree. We're just starting to look at that benchmarking data and trying to educate our stakeholders here in terms of how to properly use that. And like you said, we can adjust our inventory, we can adjust our numbers, but then we're comparing. And you hear this a lot of time in other conversations. Well, what are so-and-so, what is the health system down the street doing, or what's the national average, or what's, you know, healthcare very much likes to compare themselves to like sizes. And we can kind of question whether or not beds is an adequate metric, but still it's one that's been used historically. And I think the power of being able to show that again as either a conversation starter or another data point to add to the conversation is very powerful. So we're just starting down that path, kind of growing from our capital planning process into, okay, let's compare to the rest of the world, and then help educate ourselves.
And Travis, has the benchmarking been something useful or something that you guys have explored there at Parkland?
We have explored, so we're a little bit unique in the sense that we compare ourselves to other organizations for the size of our fleet, different types of devices and all. But the challenge you run into is that we're a public hospital and we're almost always at maximum capacity. Because usually we have a line of people out the front door waiting to get in. So for us, it's hard to compare ourselves to some other organizations that are, typically running 50, 60% overall bed capacity. We have high volume, high usage, high throughput of our patients. So we have a very high throughput in and out the door. And so for us to benchmark our inventory against other organizations, we've done that a number of times, but we keep on finding ourselves in a situation where we're not really aligning with other organizations. And a lot of it has to do with maybe have similar size bed count, similar patient demographics, but the volume of patients in and out throughput is significantly different, and that has a significant enough of an impact to make us kind of question where we belong on those benchmarking charts. So, but we're still, it's something it's always on the forefront. We're always looking at it and comparing ourselves. A lot of times we compare ourselves and say, yeah, we're different, but we accept that, or maybe we do have opportunities. So it's always right there being evaluated, but we haven't made a lot of adjustments for that yet.
But I think you bring up a great point. I mean, healthcare, as we know, is so regional. Like it really is. Obviously, your organization, your size, your specific characteristics, and then your patient demographics. But your region, your area, like those are all real massive impacts. And so that's something we also allow is that internal benchmarking to be able to compare, site A to site B or clinic system or whatever you're doing inside of your own organization to say, hey, our internal standards are this number of devices per bed or the metrics that you're using. And I agree with you, Bob. Beds is maybe not the best count to measure a health system. Travis has pointed out really well, patient volume is definitely a factor. And I know all of your patient volumes are high. Everybody's seeing lots of patients these days. It's the fall and we're coming off of a global pandemic, so everybody's busy. All right, as we're wrapping up our time here, I'm really grateful that you would share all of this deep knowledge with us, but I wanted to ask a question around the devices that are on your environment. So I want to know, since you've turned the Medigate platform on, what is the most odd or strange device that you've seen come up on your network, or is there anything that surprised you that when you started looking around at what's connected to your network, you're like, wait, what is that? Or I know an example that I've got some good examples of that too, but I wanted to hear from you guys as you've turned this on and started to look around at the dashboard and play with the data. What are some things that surprised you, or what was a device that you're like, we have one of those? Anything like that comes up for you guys?
Well, I don't think I had any really devices that caught me off guard. We pretty much knew what we had in network because we had to configure it all. So the one thing that did catch us off guard a little bit was the number of devices we have running Windows XP up there. It's a lot. We had no idea. We had a gut instinct. We had some manual inventory in our database of different OSs out there on our systems, primarily in diagnostic imaging. But you have the filter capabilities built in for your active inventory to filter it down by OS, and wow, we got a lot of very out of support OSs on our network. So that was the biggest shocker for us.
I'm sure those got elevated pretty high on your risk priority scale there, having those XP devices.
It led to a nice conversation with our CISO.
Can imagine. Tracey or Bob, anything that either surprised you or you found just interesting connected to your network?
I can say that, because the Medigate platform allows you to kind of separate your views in terms of corporate network and guest network, I didn't really have a lot of surprises as to what was on the corporate network. Guest is a different issue entirely. I never realized how many gaming systems were on the guest wireless network. But I'll say this, something though on the corporate network that was surprising is the devices that we're trying to communicate externally. And while we had it blocked at the firewall because we have geoprotection rules that keep devices from talking to areas of the world that we just don't do business in, it was interesting to see, at the firewall level, you can see those transactions, but now at the Medigate level, you can actually see the device and where it's trying to go. And then it just prompts the question, like, why? Like, why would that device need to communicate to X? Yeah. And that's led to some interesting discussions with IT and also with some equipment manufacturers. Some interesting discussions.
Yeah, I'm pretty sure that they don't have a host server in North Korea. That's probably safe to say. Most of our medical device manufacturers are not wanting us to send data there. That's just, yeah.
Exactly. Yeah.
But I would agree with Bob. I think when we got everything on, we have the 65,000 medical devices. For us, it's about a third of our devices are on the network, so we have about 26,000 that are medical. Of those, and seeing them, I was pleased to see that, we didn't have rogue medical devices on a guest network or somewhere that they shouldn't be, so that was good. We've got the network access control that's coming in, and I think really keeping things from just popping up that shouldn't be on there, so that's encouraging. I agree with Bob. I think seeing the communication map and seeing not even so much like, with talking, to North Korea or, some other area, but a device that's, cabinet or, something like that, trying to talk to an EKG machine or, something that, you're like, why? This doesn't make any sense, that you've got kind of that communication that's going on and being able to kind of help use that to establish the rules,
Yeah, I've heard other customers report, we had this one device trying to connect to our guest wireless out from our parking lot. Oh, it's the Tesla that Dr. So-and-so brought in today. and it's trying to, send traffic. And I guess that's okay on the guest network. That's probably as long as you got the right rules on your guest network and blocked it off. But it's the world we live in today. There's devices everywhere and they all want to connect and they all want to do what they need to do. And hopefully it's not to self-drive that vehicle too much. We're not sure about that one yet. Tracey, Bob, Travis, I'm so grateful that you would spend this time with us today and to share the knowledge you have and to talk about how clinical device efficiency has made your lives better and your organization's lives better. And I hope the outcome being is that your patients' lives are better as well. So we're really grateful for your time today.
You're welcome.
Thank you.
Thank you all so much for a great presentation today. This does conclude our on-demand webinar. If you enjoyed today's presentation, you might also enjoy our ongoing webinar series, Webinar Wednesday. You can find a calendar of our upcoming live events as well as an archive of our on-demand webinars at webinarwednesday.live. To obtain your continuing education certificate for 1 hour from the ACI, please remember to click the link located below this webinar title to complete the survey. If you have any questions, please contact us at webinar@mdpublishing.com.